Hey y'all. All right. I was just working on some study kits here. All right, guys. I was so busy posting I lost track of time. My fault. All right, so I'm gonna give y'all some time to come on in the room. Oh, let me put up what we're doing. All right, so if you are here, if you saw the title, it is time for NCLEX Jeopardy. Gang, gang, right? Gabster and Limitless. What's up? All right, so let me put up. Okay. Good evening. Hello, hello. All right, so hello, I am Nurse Sam. If you guys don't know, hopefully you do know. I'm Nurse Sam. I'm going to be your host of NCLEX Jeopardy, like I am every week. What's up, everybody? And if you have a farm notes, wait, hold on. Where I can find it. Farm note cards. I'm not sure what that means. All right, so like I said, hello, I am Nurse Sam. I'm going to be your host of our live NCLEX Jeopardy. Okay, so it is the 29th, so we're obviously at the end of the month, September. And during this month, we went over these topics right here. Well, except for pharmacology, but we kind of touch pharmacology every time we have a topic because it's in everything. But week 1, we did nursing skills and skills lab. Southern Beauty, I have a pharmacology study kit that has 50 common drug cards in it. I have that. You can get that individually in the first semester bundle or in the ultimate semester bundle, ultimate nursing school bundle. But yeah, so first week of February, we did nursing skills and skills lab. We did, for weeks 2 and 3, we did MedSurg 1 cardiac, and then 3 was MedSurg 1 endocrine. And then this week, we studied maternity, all right? We did week 4 a little bit different than all the other ones. I went live pretty much every day this week, and we went over for about like an hour and a half, 2 hours. Every night, we went over those main topics within maternity. And I'm going to see how well y'all listen. I'm going to see your study skills and your comprehension level, where y'all at, okay? She the pretty I take NCLEX tomorrow. First of all, if you're taking NCLEX tomorrow, you should be relaxing, Miss Ma'am, okay? But yes, anything I tell you for today, study-wise, isn't really going to help. But I can give you some tips as far as like the morning of, all that good stuff. But good luck, boo. You got this. Send one up for you. You got it, boo. All right. But starting here at NCLEX Jeopardy is a great way to kind of just make sure that you are, it's a great way to assess your comprehension level, see where your weak areas are, see where your strong areas are, all that good stuff. But because we did maternity this week, we're going to be maternity heavy as far as the NCLEX Jeopardy, but I am going to be dropping some of the previous week's questions as well, just to make sure, like I said, you guys comprehend everything. And even if we don't get to those questions on our live, I've already reposted a few of them in my stories, as well as my subscriber only stories. So if you are not a subscriber, you want to make sure you subscribe to my Instagram page for only $2.99 a month. You'll get the replays to NCLEX Jeopardy, to the lives from this month, and subscriber only content such as stories and posts and all that good stuff. Okay? All right, so let's go ahead and get started. Like I said, we're going to jump right into it, okay? Was anybody here? Well, let me start by saying this. Is anybody here for the first time? Do I have any first-timers here for NCLEX Jeopardy? Okay. Do I have any first-timers here for NCLEX Jeopardy? Just in case I do, I'm just going to run over the rules just really quick, and then we're going to get right into playing. Okay? So, this is NCLEX Jeopardy. You are going to... Oh, hey, Southern Beauty, what's up? LAK First Lady. Ms. Lucky, if you want to play, come on. Limitless Faith. Nika, awesome. All right, so these are the rules, just really quick. So just like you see this screen, the NCLEX Jeopardy plus the categories, you're gonna see the question and the answer choices. All right, so you'll be able to see this question on the screen. We are gonna go through, we're gonna read through it, but you do not have to answer. You don't have to wait for me to read through it in order to answer. Okay, so the purpose of NCLEX Jeopardy is for you guys to sorry, I got a message. Yeah, the purpose of NCLEX Jeopardy is for you guys to be, to, like I said, practice, assess your comprehension level, assess where you are with certain topics, or just a great way, and it's also a great way to practice and review for the NCLEX, whether it's NCLEX RN or NCLEX PN, okay? So you want to practice, make sure that you are taking practice questions. It's a great way to review. And plus you also want to make sure that you're up on your time. If you suffer from test anxiety, thinking about that time and panicking about the time, making sure like, okay, I don't want to run out of time, that can add on and compound the anxiety and really cause you to just spaz out. So practice is literally the best way to progress so you can get used to it. Kind of like muscle memory, but like your mental muscle. Okay? All right, so practice questions where? I'm going to bring them up right here. Okay? We're going to go through them together. So this is how the rules will work. After I upload the question, you guys see it, read it, you're going to answer. It is Jeopardy style. All right, so you have to say what is prior to any answer. Okay, are these, you're going to have some multiple choice and select all that apply. I don't think you have any fill in the blank, at least not during live. I'll have some in my stories. Okay, so remember, you have to say what is before your answer. Now, there's two ways kind of you can play. If you want to play just so you can kind of get your review in, awesome, whatever, just answer. But if you are playing for prizes and actually want to like really participate to be first, then you have to, like I said, say what is. All right, the first person to answer correctly, and you have, like I said, you have to say what is. First person to do that and answer correctly is going to be the winner of those points. So if I say we're doing maternity for 200, and you get it first, and you say what is, and you get the answers correct, then you're going to be the winner of those 200 points. Now, at the end of the game, the person with the highest amount of points is going to win a free Ultimate Nursing School bundle. Okay, so that's regularly $97. It's a digital 400-page study bundle that includes everything from fundamentals all the way to like mental health, maternity, all that. Okay, that's actually one of our best-selling, if not the best-selling product that we have. So it's actually 4.98 stars out of 5. Someone was mad because they couldn't print it, but it's fine because it wasn't printed. You can print it. It's digital/printable. Okay, so y'all ready to play? Give me a thumbs up if you guys are ready, if you understand the rules, and y'all are ready to go and review. Give me a thumbs up if you are ready to review. Once again, just in case for all my newbies here, because this is actually like a live and some people have varying internet strengths, I can only go by what I see on my screen. So for instance, if like Teddy Birdlove answers first on my screen, but Sweet Persuasion maybe answers first on your screen, I can't see your screen or her screen. I can only see mine. And sometimes when two people submit answers at the exact same time, or maybe a split second apart, it'll do it. But it depends on if there's a lag. So like I said, I can only go by who's on my screen. Obviously, the actual NCLEX is not Jeopardy style, so you don't have to worry about saying what is, and you don't have to worry about being the first person. But because we are incentivizing this review, we're making it fun. We're playing for prizes. We're just going to have some friendly competition. Okay? All right, so I'm getting a whole bunch of thumbs up. That means you guys are ready to go. Let's see if you guys have been paying attention to all my posts this month, especially this week with maternity. Okay, so let's go ahead and get into it. First one, let's do maternity for 200. All right, remember, like I said, you do not have to wait for me to read through this for you to answer. I do recommend you probably type in what is and then maybe copy it so that every time the question comes up, you can just kind of paste it and then put your answer. It'll save you a few seconds if you really want to win that free prize, that free Ultimate Nursing School bundle. Okay. All right. So first question reads, and it's maternity for 200. The nurse is reviewing the record of a client who has just been told that her pregnancy test is positive. The nurse notes that the healthcare provider The nurse notes that the healthcare provider has documented the presence of Goodell's sign. The nurse determines that this sign is indicative of which change that occurs with pregnancy. A, softening of the cervix. 2, presence of fetal movement. 3, presence of human chorionic gonadotropin, or HCG, in the urine. And then 4, a soft blowing sound that corresponds with the maternal pulse that is heard while auscultating the uterus. Okay, let me see what y'all are saying. I'm getting lots of 1s or A's. Getting a lot of it. Okay, so let's see what the correct answer is and who got it first. All right, so maternity for 200. Let me get my handy dandy scoreboard. All right. Ooh, nope, not this pen. Ooh. All right. And the answer is, drum roll, please. What is 1? A softening of the cervix. All right. During the early weeks of pregnancy, the cervix becomes softer as a result of pelvic vasoconstriction, which causes Goodell's sign. Cervical softening is noted by the examiner during a pelvic examination. Okay. Okay, C. Wayne, I didn't even ask the question yet, but yes, I was just about to ask. What kind of sign is this? But C. Wayne just answered it. Is it what kind of pregnancy sign is it? Is it a presumptive sign? Is it a probable sign? Or is it a positive sign? Remember, you have like 3 categories of the signs of pregnancy, ranging from, I kind of guess, I kind of think I'm pregnant because I'm having this. And that's presumptive. And that's examples of that is like nausea, vomiting, especially like morning sickness. It's objective data, things that cannot be measured. All right. It's per the patient. If they say that their breasts are tender, there is no breast tenderometer. Okay. That would be like, it is 32% more tender than usual. Girl, you may be pregnant. It's not a thing. It's per patient, objective. All right. Now the next type of sign is probable, which includes Goodell's sign. All right. Whenever you see, honestly, a little tip, whenever you see something sign related to the signs of pregnancy, it's usually a probable sign. Okay. You have a Goodell sign, which is softening of cervix. Can anybody tell me another type of blank sign that is a probable sign of pregnancy? What's another sign that's a probable sign of pregnancy? And when I say, I'm going to say that. What's another probable sign of pregnancy? Give me one more. Chadwick's. And what is Chadwick's? Gapster and T 2 times. And C. Wayne, what's Chadwick's? Heger's is also one, absolutely. What is Chadwick's sign? Just so we know. Just so we know. Okay? A positive pregnancy test, whether blood or urine, is testing for HCG, so that it's probable. That is correct. Yeah, it's a bluish violet color. I learned it as violet. Some people learn it as like a bluish violet. But yes, it is the bluish color of the one that starts with a B. Ballotment. C. Wayne said the one that starts with a B. It's like ballotment or something like that. Yes, it's the bluish appearance of the cervix. I say, okay, this is why I remember it as violet. I always learned it as violet. And to help me remember, when I think of Chadwick, I think about Chadwick Boseman, rest in peace. Black Panther himself. And when I think about Black Panther, right, their actual, like the actual cover of the movie or the poster, you know, it had that, actually, I'll find it again. It had the, like the purple stripe. I'm gonna find it, wait for it, because that's actually what we themed our health assessment thing off. So this is our health assessment. This don't say Marvel, this say nursing. This is our health assessment little study guide, but this is themed after Black Panther / Chadwick Boseman. It even says in loving memory of Chadwick Boseman, rest in peace. But yes, this little violet color here, I associate that with Chadwick Boseman, with Chadwick's sign of a probable sign of pregnancy. Okay. All right. Let me see who got that one first. Great job to everyone that answered that. A lot of people got that correct, but once again, I am going for who got it first on my screen. What is, and it's C. Wayne. Hey, C. Wayne. C. Wayne. Underscore. All right, you're on the scoreboard with 200 points. Congratulations. Great job to everyone else that got what is A or got what is 1. Awesome job. Remember, if you want to play for points, you have to say what is before putting the answer. If you don't want to play for points and you're just honestly just here for the review to see what you get right, have at it. Just put A. Just put the answer. Okay? But I just want to make sure y'all know. Okay? All right. So let's go ahead and go to the second question. This one is maternity for 300. All right, maternity for 300. It says, the client is undergoing an amniocentesis at 16 weeks gestation, to detect the presence of biochemical or chromosomal abnormalities. Which instructions should the nurse reinforce to the client? 1, the bladder must be full during the examination. 2, the bladder must be empty during the examination. 3, she should not eat or drink anything 4 to 6 hours before the examination. Or 4, she will be given Rho D immune globulin. Yeah, Rho D immune globulin because she is Rh positive. That's that RhoGAM stuff. Okay, what is our answer? What is our answer? All right, so little test taking tip here. Well, I'll get into that after when we get to the answer. All right, so when you're taking your NCLEX practice questions and your practice tests, you want to aim for about a minute, no more than a minute and a half per question. You just kind of want to just set that standard across the board. So like I said, when you are going through the actual test on the NCLEX, you don't have to worry about time, okay? So if you try to keep it to about a minute or less, great. But remember, there is a time frame, and everything that you do not answer after that time frame has allotted, it's not gonna count. It's gonna be incorrect, okay? All right, so let's go ahead and see what the actual answer is. Getting like lots of 1s and 2s. So let's see what the answer is. What is this again? Maternity for 300. All right, and the answer is, wait for it. What is 1? The bladder must be full during the examination. All right. Are all NCLEX questions multiple choice? Select all apply. No. You have alternate question types, and that's for the current NCLEX. On the next gen NCLEX, that's going to be the new style of NCLEX that you're going to be taking April 1st of 2023. That's going to come with quite a few different alternative format question styles. It's still going to be, it's majority then and now, but it's majority multiple choice. But you do have those alternative question items, all right, to help, just to make sure that you guys aren't, it's to really assess your critical thinking. That's why you have all these different types of questions. But let's see what the answer is. All right, scroll all the way up The answer is what is 1. Let's see who's the first person to get it. What is 1 or what is A? Sweet persuasion. Great job, boo. All right, so sweet persuasion. I'm just going to persuasion. 1225 with 300 points. Awesome job. Who else got what is 1? Gapster, Silly Wabbit, D. Drew, Anna Mac. Awesome job. I'm gonna do my screen be saying that answer first until later, like I'm never the first. Aw. Let me see. Yeah, she came before you. If she didn't come, well, there was like one person that answered between her answer and your answer. But you were the second person to get it correct, Gapster. So great job. All right. No, joke's not on you every time because like I said, on the actual NCLEX, it's not like a race to the finish. All right, so let me go ahead and go over the actual rationale. Okay. So it says, before 20 weeks gestation, the bladder must be kept full during amniocentesis to support the weight of the uterus. Okay. After 20 weeks gestation, the bladder should be emptied to minimize the chance of puncturing the placenta or fetus. Now, the Rho-D immune globulin is administered to Rh negative women because of the risk of contact with the fetal blood during the examination. Remember, the question said that she was positive, Rh positive. So that one's out. There are also no fluid or food restrictions prior to amniocentesis. Monitoring the fetal heart tones and the vital signs throughout and after the examination is an important intervention. Okay. Wait, let me see what you asked. Jade said, why if they are high risk to... Are you saying what if they are high risk of miscarrying? I'm not sure what you're trying to ask, Jade. Reword that. Or tell me why if they are... Yeah, reword that. I'm not sure what you're trying to say. But yes, okay. Little tip that was what I want to tell you guys. So whenever you see a multiple choice question, not even a multiple choice, because it could be multiple choice or select all that apply. But let's go with multiple choice for now. Whenever you see a multiple choice question that has answer choices like the ones we just saw, and I'm gonna bring it back up just so we can see it. All right, like 1 and 2. All right, 1 says the bladder must be full during the examination. 2 says the bladder must be empty during the examination. Okay, whenever you have a multiple choice question and you have 2 answer choices that are just so total opposite, it's usually a high hint that it's going to be one of those 2. Okay, you can't go in and say, how do you turn the lights on and then have, A, B, turn the light switch up and then turn the light switch down. Like, it's going to be one of the 2. Usually when it's like total opposites like that, full versus empty. Which one? It's usually a very high hint. It's a very high chance that one of those 2 answers will be the correct one. Okay. Same thing if you have 2 answer choices that are very, very similar or basically say the same thing. So if you have, what's an example? If you have one that says, like hypovolemia, so low volume, hypovolemia, and something that's like dehydration or hemorrhaging, anything that would cause the blood volume to be low, those are synonyms. Okay, so that's another quick little NCLEX tip for you guys. It's a test taking strategy. All right, let me go back up to what y'all saying. How long is the NCLEX timed? Ooh, I think it is 300 minutes, or it might be a little bit less. But while y'all answering this next question, I'll look it up. All right. Yep. Great job. Maternity for 300. Let's go to the next one. Attorney for 100. If you guys came to yesterday's review, y'all will most likely remember me talking about this. Y'all will most likely remember me talking about this. Kira, the answer was number 1. So the bladder must be full. Okay? It must be full if it's before 20 weeks. If it's after 20 weeks, the bladder must be empty. Okay? But yes. So this is maternity for 100. The nurse caring for a client with abruptio placentae is monitoring the client for signs of disseminated intravascular coagulopathy, or DIC. The nurse should suspect DIC if which is observed. 1. Rapid clotting times. 2. Pain and swelling of the calf of one leg. 3. Laboratory values that indicate increased platelets. Or 4. Petechiae, oozing from the injection sites, and hematuria. What is our answer? Another tip I always give, especially for you guys that's this is your first time with me, I'm always going to give like test-taking strategy tips throughout the whole NCLEX Jeopardy. All right. Not only do I want y'all to review the content, but I also want y'all to review the strategy, because you need both. You need both to pass the NCLEX. You need both strategy, okay, and you also need to understand the content. Great. All right. So after you read the question and the answer choices, I always recommend going back and at least reading the last sentence so you can remind yourself of what the question is really asking you to answer. Okay. So once again, let's go back. The nurse should suspect DIC if which is observed. Okay, so looks like we're looking for a clinical manifestation that's indicative of DIC. Okay, so let's look and see what that answer is. Let me see what y'all are saying. Getting lots of 4s, but I'm getting some 2s as well. Okay, so let's go see what the answer is. So maternity for 100, and the answer is what is 4? Petechiae, oozing from the injection sites, and hematuria. All right, it says DIC is a state of diffuse clotting in which clotting factors are consumed, which leads to widespread bleeding. All right, platelet counts are decreased because they are consumed by the process. Coagulation studies show no clot formation. Clotting times are thus prolonged, and fibrin plugs may clog the microvasculature diffusely rather than in an isolated area. All right, so the answer is 4. Ooh, look at y'all. Who said what is 4 first? Sweet Persuasion. Awesome job, boo. All right, Sweet Persuasion, you're already on the scoreboard with 300 points. You just got another 100. So you are now at 400 points. C. Wayne, you're at 200. All right. So I have more questions to go. It can be anybody's game. All right. Anything that we do not finish by 8 p.m. will be in my stories. There are going to be a few questions in my stories, but there are going to be even more questions in my subscriber only stories. Okay. Who else got it? What is 4? C. Wayne also got it. Misha Feelgood. I'm the ambitious one. First Lady. Miss Fifi. Desi. Jade. Gabster. Shaquita. Tia. Awesome job. She the pretty one. Wallflower. Ms. Yeb. Jaleese. Awesome. All right. Let's go ahead and get into our next question. So that was maternity for 100. So let's do hold on. Let's do this one. Maternity for 500. And this is select all that apply. Okay. All right. So it says the nurse is collecting data from a client who has been diagnosed with placenta previa. Which findings should the nurse expect to note? Select all that apply. 1, uterine rigidity. 2, uterine tenderness. 3, severe abdominal pain. 4, bright red vaginal bleeding. And or 5, soft, relaxed, non-tender uterus. Okay, which findings should the nurse expect to note in a client that's been diagnosed with placenta previa? All right, now remember, this is select all that apply, and I always say this. If you're taking, okay, really it doesn't matter if you're taking it now or later. If you're taking it now before April 1st, then you know that select all that apply is literally, quite literally, you must select all that apply. If you miss one, or if you don't select the correct one and you select an incorrect one, you don't get partial credit. That answer's wrong, okay? It's either all or nothing with select all that apply currently. Now with the new and next gen NCLEX, that's April 1st, 2023, you will start to get partial credit, but I'm gonna always advise that you take these, and when you're taking and studying for these questions and reviewing, you always want to act as if you aren't getting partial credit. That way, if you do, it's a great surprise, but you're not using that as a crutch to be like, oh, I don't know this last one, but at least I know these, so I'm gonna get partial credit, blah, blah, blah. Don't even set yourself up like that. Just study the same, all right? The content's always gonna be the same. How it's presented is gonna be different. All right, so I am getting your answers. All right. Another thing about select all that apply, I'm going to say this while I change the, pull up the actual answer. It can be as little as one of those answers that's correct, and as many as all, either 5 or 6. There's usually 5 or 6 with select all that apply, or multiple response. Tomato. So, yeah, that's the tricky part. All right, so the answer to this one for Maternity 500, the answer is, if I can find it. Okay, and the answer is, what is 4 and 5? 4 and 5. Okay, let me go back up to see who got it first. Misha Feelgood got it first. Awesome job. And then it was my dog Gapster. Ooh, Gapster, you was so close. All right, so Misha Feelgood, great job. Congratulations. You got that correct first. And you now have 500 points. All right. Who else got 4 or 5? Like I said, Gapster got it. E Love got it. Awesome job. And I confused myself. That's okay. That's why we do these reviews, so that you can get all that confusion out. And we can go through the actual rationale, so that when it's time for you to take the actual NCLEX, whether it's tomorrow or whenever you take it, you won't be so green. Let me just say that. Okay. All right. So the actual rationale behind this is, the answer is, once again, what is 4 and 5? Bright red vaginal bleeding and soft, relaxed, non-tender uterus. All right. So I don't know if y'all was here with me yesterday. We went over pregnancy complications and postpartum complications and pregnancy complications. All right. Placenta previa and abruptio placentae. Those are always like, you're gonna always have a question that's gonna ask you to differentiate the two. Or differentiate the clinical manifestations between the two, okay? Because they present similarly, but those details is what's going to let you know, like, which diagnosis to go with, or let the provider know which diagnosis to go with. All right, so it says painless bright red vaginal bleeding during the 2nd or 3rd trimester of pregnancy is a sign of placenta previa. Okay, the client will have a soft and relaxed, non-tender uterus. In clients with abruptio placentae, severe abdominal pain is present. Uterine tenderness accompanies placental abruption. Additionally, abruptio placenta, the abdomen will feel hard and board-like during palpation, as the blood penetrates the myometrium and causes uterine irritability. Okay. Awesome job, everybody. But yes, so if you need some help trying to remember the difference between placenta previa and abruptio placentae, look in my maternity study guide because it definitely has a page on that. All right. Here's a little tip though. For placenta previa, you can think about the mnemonic previa, literally previa. All right. The P in previa stands for painless, bright red bleeding. The R stands for replace blood loss. The E stands for it's evident in lower area. The V stands for vitals point to shock due from the blood loss. So it'd be like a hypovolemic shock. I is for inspect the fetal heart rate, because once again, I don't know if I said it today, but with the thing with maternity and why maternity is so, I won't say hard, but challenging to get used to studying for, especially off rip, is that it's, I think it's literally the only specialty where you have two clients in one, if that makes sense. Like you as a nurse, you're going to, as far as maternity, you're going to be assessed on your comprehension, on your like critical thinking, your critical nursing skills, and also specific to maternity, your ability to keep both mom and baby safe. Okay, so whatever, especially in the womb, whatever is happening to mom, most likely happening to the baby as well. Okay, if mom is losing blood, and blood is what carries oxygen to our fetus, mom is losing blood, baby's also losing oxygen. Does that make sense? Okay, so yeah, so inspecting the fetal heart rate. All right, that fetal heart rate is going to let you know what that oxygenation status is looking at. That's when you're looking at those patterns, those early D cells, late D cells, variable D cells, like veal chop. That's what you're looking at. Okay. And then the I in previa is avoid vaginal exam. Okay. When you have a patient that's maybe suspected of a placenta previa, you always want to avoid doing a manual like vaginal exam. Does anybody know why? PPP, right? PPP, not the PPP loan. But yeah, do you know why you avoid vaginal exam in clients with placental previa? Do you know why you are avoiding? Right, it can cause further bleeding, excessive bleeding, or even more bleeding. It's the bleeding more so than the risk for infection. It's more so the bleeding rather than the rupture of membranes for placenta previa. Okay, that can just further disrupt. It can further detach that placenta, which will just make that hemorrhaging, that bleeding much worse. Okay. All right. Wait, let me go back to. Did I give points? I did. Awesome. Did I read this? I did. What about abruptio? Hold on one second. Okay. And I just told you about abruptio placentae as well. If you got this question incorrect, don't beat yourself up about it. Instead, just note the things that that slipped your mind, that you couldn't recall. Note these signs and symptoms, these manifestations, so that next time when you come across it, you're good. You know, like I said, use this game as a way to assess where you are in your standing, your comprehension level. Take notes if you need to. Okay. Next question. Great job, everybody. What are we doing? Let's do this one. Maternity for 300. Maternity for 300. The nurse palpates the fundus and checks the character of the lochia of a postpartum client who is in the 4th stage of labor. Which lochia characteristic should the nurse expect to note? 1 red, 2 pink, 3 white, or 4 serosanguinous? Which lochia characteristic should the nurse expect to note of the lochia of a postpartum client who's in the 4th stage of labor? Oh, this is like a 2-part question. All right, this is the 2-part question, and I'm gonna ask y'all this. Okay, after you put your what is answer, tell me. Do I want to say that? Hold on. I don't know if I want to say that just yet. Just give me 2 seconds. I don't know if I want to ask that question just yet. Okay, stage 4. I'll ask it. Stage 4. What stage is stage 4? The 4th stage of labor? Which stage is that? You don't have to say what it is. Just tell me what it is down there in the comments. What is the 4th stage of labor? What's another name for it? What's the 4th stage of labor? Just tell me. All right. Let's see what the answer is to this one. Getting majority 1s, but I'm getting some mixed, some like 2s and 3s as well. Right. It's the postpartum phase. Well, it's the postpartum stage. And that is, the postpartum stage is up to how many hours after delivery? It's postpartum. You're right. You're right the first time. Postpartum is definitely the 4th stage, and that's up to how many hours? It's 1 to 4 hours after delivery. The first 1 to 4 hours after delivery is the postpartum stage, and then it gets into the stabilizing phase. Okay, right. First 4 hours after delivery is the postpartum phase. All right, they just pushed out. She just pushed out a whole baby, I'm gonna need more than 2 hours to get right, to be okay. All right, and then after those first 4 hours, which is the postpartum stage, then comes the stabilizing phase. Okay, now the answer to this question, during this stage, during the 4th stage of labor, right after we deliver both baby and placenta, now we're just recuperating, recovering, and officially entering the postpartum stage. During postpartum assessments, one of the things that you have to do, as kind of like explained in this question, is assess bleeding. Assess they call it the lochia. All right, you gotta assess a few things about it. Let me see if it says it in here when I tell you guys the actual answer. All right, so I don't think it does. That's fine. But yes, when you're assessing the bleeding of a woman, of a postpartum woman within that 4th stage, you're assessing the color, you're assessing the amount, you're assessing the odor. All right, now color is very important. Obviously, in addition to odor, because if it's giving infection, you got to say something. All right, but as far as the color, that's going to be how we assess the different types of bleeding, aka lochia, of a postpartum woman. All right, the answer to this question was red. All right, the answer is red. Now, when it comes to the lochia of a postpartum woman, let me go to it. All right, there's 3 main types: lochia rubra, lochia serosa, and lochia alba. Okay, rubra sounds like ruby, like a ruby red, and that's when you're gonna have your dark red color, bleeding color, within the 3 to 4 days. Okay, you can expect that within 3 to 4 days. Now, it's important to note the color, the type/color of the lochia, and it's also important to know what's normal versus abnormal, especially time-wise. Like this lochia rubra, the dark red, that's supposed to be, you're supposed to expect that the first 3 to 4 days. If you're getting into like the 10-day mark, the 11th, 12th day mark, whatever, if you're up there past delivery, a few weeks, okay, and you still have that dark red bleeding, that is abnormal. All right. As time goes on, that bleeding is supposed to get lighter and lighter, almost like you end in a period. Think about that. Okay. So lochia rubra is that dark red blood within the first 3 to 4 hours of delivery. Lochia serosa is 4 to 10 days postpartum, and it's that brownish pink, that pinky brown. It's giving like post period. You don't have to put a pad down, but just like a liner to not like mess your new Skims up and mess your new 7 for 27 from Victoria's Secret, girl, whatever. But yes, that is lochia serosa, a pinkish brown, 4 to 10 days postpartum. And then finally the lochia changes to like a creamy white color that occurs from day 10 to 14 postpartum. Okay. It really can go 10 to 28. You know, depending on, just as long as at the 10 days you're looking a bit white, creamy white, then we're good. But it's 10 to 14 days, can either be 10 to 28 days. Okay. So dark red, brownish pink, creamy white. Okay. Let's see who got this answer first. E-Love. All right, E-Love. You now have 300 points. Who also got it? C. Wayne, Misha Feelgood, Wallflower, Paradise Jazz, She the Pretty One, First Lady, Future Nurse Nika, P. Hargrove, and great job to everyone that said the postpartum phase. Awesome job. If the patient is soaking pads in 15 minutes or less, that's abnormal. Absolutely. Absolutely. All right, next question. Where are we? That was 300. All right, let's go to our next question. Let's do this one. All right, GT Pal. Let's do this one because you're definitely going to be assessed for this. You're definitely going to get at least one question about this. All right, so this is for 500 points. A woman is 24 weeks pregnant. She had a previous stillborn neonate at 38 weeks gestation and a pregnancy that ended at 34 weeks with the birth of a stillborn girl. She states she has a 4-year-old son and an 8-year-old daughter who live with her at home and were both born at 38 weeks. What is her gravidity and parity using the 5-digit system? GT-PAL. All right, remember GT-PAL that's how you obtain obstetric history. All right, each of those letters stands for something. G stands for gravidity, which is the number of pregnancies. P stands for paridity, parity, whatever. That's the number of viable pregnancies. All right. Now, when you hear the word viable, you want to think about the ability to survive outside the womb. So usually viability isn't until like I think 22 to 24 weeks viability. Yeah. So not preterm, but that's just viable. Ability to survive outside the uterus. What's the absolute minimum they need to be baking? 22 to 24 weeks. The P. I skipped T, my bad. The T is for term, which is full term births, and that has to be at least 38 weeks. The P is for preterm, my fault. And that is for viability. That's 20 to 37 weeks. But it starts with when they're viable all the way up into what's supposed to be a full-term birth, which is 38 weeks. So it goes from 20 weeks to 37 weeks. The A is for abortion, and that's spontaneous or elective. Okay, so miscarriages are a type of spontaneous abortion. So any type of like spontaneous miscarriage would qualify under the little A. Okay, and that's before 20 weeks. And then the L is for live births, or like live living children. All right, so given the explanation of G.C. Powell, let's see what our answer is. And the answer is, drumroll please, what is 4? G5, T0, P4, A0, L2. Okay, let's look and see who got what is 4. A lot of people say 2 and 3. Why did a lot of people say 2 and 3? Wait, did nobody get that? Hold on, let me go back to it so I can make sure I'm not tripping. I'm sorry, I read too fast. I'm a little moody. I'm sorry. You didn't say what is, and B, I put the answer up after you posted number 4. Sorry. I didn't have time to think, y'all, too fast. G.T. Powell. All right, so let's go over this one. So it says the woman has had 4 previous pregnancies, all right, and is now pregnant. So I was confused on the stillbirth. I have to calculate things. I can't do it under pressure. You gotta do it under pressure. Did I not give y'all enough time? My fault. I need my dry erase board for this one. That's why you trust me, on the NCLEX, you'll have some scrap paper. Because I surely did have to be like, 1, 2, G. Listen, y'all know I'm a visual person. I wrote out plenty. All right, so GTPAL, child. If you need a little like worksheet to help you through, my maternity nursing school study kit has like a GT PAL like worksheet that gives you like the definitions to help you kind of keep it all in one place, so that as you read through the patient's chart or their history, you can write it there, so you can so you don't get mixed up. Makes sense. Pressure is real. That's funny. All right, so let's go back to the question really quick. Well, let's just read it. It says the woman had 4 previous pregnancies and she's now pregnant. So 4 plus 1 is 5. She had 5 total pregnancies. All right, so that G is going to be 5. All right. So she had 3 term pregnancies. Let's go back to the actual, the pressure is getting worse. Do not talk to me in TikTok. Y'all know I will die laughing. All right, let's go back to the actual question. Hold on one second. Ooh. Okay, here we go. Nope, that's not the question. That's not the question. That's the answer. We're already there, girl. Question. Okay. It said she had a previous stillborn neonate at 38 weeks. And a pregnancy that ended at 34 weeks with the birth of a stillborn girl. Okay. So as far when we bring up our sheet, oh no. All right, where does it? It says she had a previous stillborn neonate at 38 weeks. 38 weeks is full term. Okay, so that is a T. Not a T. I'm so sorry. It's actually, let me go back to the thing. What explanation did it give? Where is it? She had 3 term pregnancies. All right. The other one was classified as preterm because it occurred once again before 38 weeks. So it was born, I can't remember. No, I think it literally said 37 weeks. So that is a preterm. Okay, so that P, the other one was classified as preterm because of her and that, so that's one. And then she had no miscarriages or abortions. Hold on, I'm confused. Now I'm confused. Hold on. She has had no miscarriages or abortions, leading the calculation to 0. Finally, she has 2 living children at home. Okay, so they said that P, well, I'm confused too. Hold on. All right, so we're agreeing that G is 5, right? Let me just go back to this answer because I'm confused. Mm. 30. She had a previous stillborn unit at 38 weeks gestation, and a pregnancy that ended at 34 weeks, not 37. But still, that should be a P. So I'm confused. That ended at 34 weeks with the birth of a stillborn. She says she has a 4-year-old and 8-year-old who live with her at home, both born at 38 weeks. So that living would be 2 because the 4-year-old and 8-year-old. The abortions would be 0 because she didn't have any abortions or miscarriages. Stillborns are not like deemed abortion, especially because they were stillborn at 38 weeks. 38 weeks and 34 weeks. So those would still count towards the pregnancy, but it would not count towards the living. Okay? And remember, she's pregnant right now, so she's only given birth 4 times. Just 2 of those births didn't result in living children. So that's why G is 5, L is 2. Now let's go into birth went for weeks. Now where are we? A is 0. T, but why does it say P is 4? Why does it say P is 4? Hold on, y'all. Let me recheck this because I'm gonna be real upset if I type this wrong. Hold on just a moment because we finna get this. All right, let's go back into it. Wait for it. Because I don't get the P. Not the P. I mean L2. $38. Right, so the T should be 3. Right? That should be 3. A is 0. So what's the P? P should be 1, right? P's for preterm. Oh, here it is. Great. Hold on 1 second. I'm just going back to it, y'all. Yeah, it's okay. G5, T0. How is that T0? Y'all, I think this is... Okay, I'm going to read y'all what they got and then what the answer is. All right, it says... It said that there's 3 term pregnancies. The other one's got started because it occurred. Okay, so P is supposed to be 1, love bug. Yeah, so that's the answer that they picked is wrong. But the GT PAL should be G5. Let me see if y'all got it. Since T can't be 0. Right, my bad. What I say, T for 0? T is term, but the daughter and the son were 38 weeks. And then the stillborn, which is 38 weeks as well. So T should be 3. Right? Preterm should be 1. 0 abortions and 2 living. So 53102. So 53102. So really it should be 3. Okay? It should be 3. So my fault. Really, it's not my fault because we all caught the error. it's their fault. We caught the error, okay? So first of all, snaps to y'all for being like, this don't go with what I learned, and I know I'm not that off, okay? So snaps to y'all for calling this publication out. So let me go back up and see who got what is 3, because the answer is definitely what is 3. The answer is definitely what is 3. So let me go back up. 53102, right? 53102. Yup. Supposed to be 3. All right, so let me see who said 3 first. Tia. Did I write down who got it first? All right, Tia. Tia got 500 points. Who else got what is 3? Paradise Jazz got it. Smile 16 got it. Wallflower got it. Awesome job to everyone that got what is 3. Now, Tia, you didn't read too fast. It's fine. All right. 5, 3, 1. P should be 1. 53102. Awesome, awesome, awesome. Right? Tia said it got me some points. Whoop, whoop. All right, great job. Let's do... I'm going to do another one in my stories because that was so irritating. All right, now let's do... it was one I really wanted y'all to do. And then we'll go. All right, do that one. Tia, you got 500 points, and you're tied with Misha Feelgood for them 500 points. So let's see who gets maternity for 300, all right? Don't forget to say what is. Let's see if we can break a tie. All right, so a pregnant client in the prenatal clinic states that her last menstrual period began April 5th and ended April 12th. According to NIDL's rule, which is the estimated date of delivery, or the EDD? January 21st, January 12th, January 19th, or December 19th. What is that answer? I'm seeing a bunch. I'm seeing a 3 and then a whole bunch of 2s. So most of y'all think January 12th. I see another person that says was 3. So other people think January 19th. Okay, let's go ahead and let's figure that out. Okay, y'all know what NIDL's rule is, right? Y'all know how to get NIDL's rule. I wanted to make sure we went over these two, like GT-PAL and NIDL's rule. I just want to make sure we had some live practice questions. Like I said, I'll also be putting it in my stories for more practice, for more practice. NIDL's rule. All right. Subtract 3, add 7. All right, but subtract 3 and add 7 to what? Right, you add 7 days to the start of the menstrual cycle and subtract 3 months. All right, you're taking the first day of your last period, subtracting 3 months, adding 7 days, and a year if applicable. All right, so remember, they're giving us the her last menstrual period. Now, whenever you see last menstrual period, they're either going to give you a date range, or they're going to give you what date it started and ended. Okay, so calculating a due date or calculating NIDL's rule, you have to take the first day of the last period. Don't let that word, don't let those words fool you. First day of the last period, not the last day of the last period. Okay, first day. So if this says that the period began April 5th and ended April 12th, that April 12th was just there to screw you up, to be honest, respectfully. April 5th is going to be the starting date that we're going to go with. That's the first day of the last menstrual period. So April 5th. April is the 4th month. April 5th. All right, what else do? We subtract 3 months. All right, if we're subtracting 3 months from April, which is the 4th month, 4 minus 3 is 1, which is January. So now we're at January 5th. Okay, now we're going to add a year. Now we're going to add 7 days. All right, so January 5th plus 7 days, 5 plus 7 is 12. So January 12th is what I would go with. Okay, January 12th. So I would say 2 based off of the calculations. Now, if they give you a year, make sure you're paying attention to the year. Okay, depending on if when you went back 3 months, you had to go back into a different year or something like that. That's when that add another year would apply. Because remember, pregnancy is like 40 weeks, which is like about 9 months. So that's why they say add a year if it's applicable. All right, so let's see what that answer is. I didn't save it? Oh, hell. Really? All right, I'm back. My bad. My fault. Y'all good? Are we back? We here? Okay, cool. So the answer is January 12th. It is what is 2. I just forgot to actually download the actual slide. But the answer is what is 2. I promise. And the way I just went through it is exactly how it is. So let me go and see who got what is 2 first on my screen. Oh, Misha, you were so close. It was actually Paradise Jazz. Paradise Jazz. So you on the scoreboard with 300 points. Paradise Jazz, 300 points. All right, so we are still in a tie for Misha Feelgood and Tia. Who else got what is 2? C. Wayne, E. Love, Sweet Persuasion, Tia, Miss Tracy. Tia, you got that question right. So actually, you are going to be the winner since you got that question right. Awesome. Let me just say I read it wrong. That is okay, boo. Reading. So I saw 12 and ran with it. I know that's right. All right. So yes, the answer is, like I said, what is 2, January 12th? That would be the correct answer. Paradise Jazz answered that specific question first. However, the winner of the overall game, based on who answered the most, who got the most points and who got the most answers correct, Tia. All right. So congratulations, Tia. Oh my God. Yay. All right, Tia, like I said, you have won a free Ultimate Nursing School bundle. It's our 400-page digital bundle that's containing everything from fundamentals all the way to NCLEX Prep, maternity, mental health. All right. It usually runs for $97, but you get it for free. Yay! Congrats. All right, so in order for you to get your prize, Miss Ma'am, I need you to DM me your full name, first and last, and a good email address. Okay? Go ahead and email me your first name, last name, and an email address. If for some reason you already have the Ultimate Nursing School bundle, do you have NCLEX Arcade? Because if you don't have NCLEX Arcade, but you have the bundle, then you will get NCLEX Arcade. Okay? Whether you are just starting nursing school or like in your maybe second semester, whatever, even if you aren't preparing for the NCLEX, I'm going to always recommend that your first day of nursing school, you embark on the path of getting into the mindset of reviewing and studying and preparing for the NCLEX. Okay? Like I won't say that. That's fine. But yes, congratulations. It's news I graduate in December. Woohoo! Awesome. All right. Great job, everybody. Great job. Oh, my fault. All right. Great job, everybody. Thank y'all so much for joining me for NCLEX Arcade Maternity Edition. Okay, this concludes our September campaign of Back to Nursing School. All right, we covered nursing basics / nursing skills, Med-Surg 1 cardiac, Med-Surg 2 endocrine, Med-Surg 1 cardiac and Med-Surg 1 endocrine, and we covered endocrine. I am probably going to circle the block and for this next month, just give you guys another, like week to week, I'm just going to focus on something different, like a different chapter. I think for October, like one of the weeks is definitely going to be like care plans. So that's definitely going to be what you guys can expect going into October. I'm in my first semester. I need all the help I can get. Ooh, congratulations. Make sure you check out the first semester bundle. That's really going to help. Contains fundamentals, dosage calc, pharmacology, nutrition and diets, health assessment / physical assessment. It's going to get you right. All right. That one's 206 pages. It's going to get you right. Now, if you guys subscribe to my Instagram, right? Remember, subscribing to my Instagram is only $2.99 a month. You get access to all these replays, including the replays moving forward, and you'll have forever access. All right? It's not like it expires in 90 days. No. As long as it's up on my Instagram and I'm alive and well and kicking, you guys will have it as far as if you are a subscriber. When you subscribe for only $2.99, as a thank you for subscribing, you'll also get a one-time code for 75% off your next digital purchase. If I were you, okay, I would take that 75% off code and I would get the Ultimate Nursing School bundle so I can have everything from my nursing program. I would, if I can, I would get the NCLEX Arcade. And then apply that 75% code to both of those. Save my money, save my coin. But you only get that 75% off code after you subscribe. So spend $2.99 for a 75% off code, so you can get all anything that you may need. That's digital, whether it's the Ultimate, first, second, third, NCLEX Arcade, Tees bundle, whatever. But that's just what I suggest for you guys. What about the people in their last semester? What do you suggest? Ultimate Nursing School bundle. Now I have the third semester bundle, and it depends on what classes you're taking. I always say Ultimate because that contains all your nursing school courses minus critical care. But if you're taking usually the last semester is like maternity, pediatrics, mental health. If you're taking those, then either the third semester or the Ultimate. I have the Ultimate. Woohoo! I have both bundles. I love the Arcade bundle. Oh, thanks. I love Arcade too. It was so fun to make and so fun to actually go through. All right, guys. So I'm going to be posting something in my stories because I want y'all to kind of vote on what topics and maybe classes that y'all want me to kind of dive into next month or dive into next. Like I said, we did maternity this week. We did skills lab / clinicals and Med-Surg 1 and 2. Med-Surg 1 cardiac and endocrine. Those are just like the most commonly requested ones. So if you guys have any suggestions or requests, please let me know. Okay. All right. So I'm going to get off live so I can go eat. All right. This live is going to be available right after I get off of this. So I'm going to upload it to our subscriber only lives. But once again, you have to be a subscriber if you want to watch these replays. Okay? $2.99 a month. Get your life. All right, guys. I will see y'all next time. Thank you.